I know you create a really interesting and important term called toxic sleep. Can you explain more to us what that is about, where this come from?
Yes, so, over the course of my practice, what I begin to appreciate is that, when something goes wrong, we typically define the symptoms, but we really don't search for the underlying root cause. And so, as an analogy, we are now more aware about something like diabetes. And so we recognize that, diabetes is not just only about the blood sugar, but it's really about the insulin. But the treatment really is exacerbating the symptoms, meaning more insulin over time is actually more toxic to your system. And as we dive into the information, we start to recognize it's the sugar that the kids and even adults are exposed to chronically that is causing all these problems that ultimately lead down the path that we describe as diabetes. So things like fructose and sucrose that is laced in our food system that is causing all these problems. So similarly, when we talk about a brain disorder or neurodevelopmental disorder, like ADHD, what we need to do is not only describe what's going on, but begin to look back into what is the toxicity in the system that is contributing to this rising prevalence of this neurodevelopmental disorder. So my suspicion is that the night, and my broader term is called toxic night, is that we are losing our biological night progressively. So with the light exposure, with social media, it's eating into our biologic night and it's affecting our children during their developmental period that is highly sensitive to protecting the night. And then that's compounded by, of course, if you're sleeping and you're having a sleep disorder, where you have disordered breathing, where you're having sleep disruption, poor environment, etc., that will add to the burden that ultimately will lead to, I think, hardware change, if you will, meaning that the brain is altered and the connection in the different parts of the brain that is altered, and ultimately it will manifest into symptoms that we observe or the teachers observe or the parents observe.
Wow. I like all these analogies and this concept to really encourage everyone look deeper. So not only the surface level symptoms, really go down to see if there's something long-lasting change really happening. Is there something wired differently in our brain? And sounds like sleep habit or what happened during sleep at night could really impact our brain, especially for children.
Right. So there's a concept, what fires together, wires together, right? It's kind of our process. As we are learning new things and doing things, we are making connections. And at night, when we are sleeping, that connection is fortified and strengthened during our sleep. And so if we are constantly making a certain connection that is tied to our reward system or a pleasure system, well, why would you expect the brain to be patient when all you're doing is rewarding it all day? Would it be surprising to think that addiction to things like social media, to instant gratification, to TikTok as an example, right? So it really something that has been observed repeatedly. But we want to address more than just the pleasure seeking, the addiction, the poor attention, the impulsivity, the lack of emotional stability. That suggests there's many brain domains that are impacted when this is occurring.
Mm.
In fact, the other side to the firing and wiring together is the idea that synaptic pruning is occurring for the brain as a child's brain is developing. What that means is that when you're sleeping, what's irrelevant information is pruned away, right? So less static, if you will, so that we can learn the tasks, so that we can stay focused, we can encode memory, those kinds of things. But if these other process of synaptic pruning isn't occurring, well, it wouldn't be surprising that the wiring may be messed up, right? For lack of a better term. We don't quite know yet what the wiring and the firing impact is occurring, although there's research that's being done looking at functional MRI,
Mm.
which, metabolism to see when, you are given a stimulus, how the stimulus triggers different parts of the brain. And the nice thing is that with advanced computing, they start to be able to, collate all this information and begin to observe a pattern. And what's interesting is that, this pattern can occur in a child. And when they test the parents, they may see a similar pattern of firing and wiring.
Oh, wow. So the parents and the children, their wiring could be very similar to each other.
That's correct. So,
Mm.
say, this neurodevelopmental disorder is lifelong. It's,
Mm.
if you suffer from ADHD, that perhaps 80% will continue to suffer through adulthood, right? So why does that occur? My suspicion again is the wiring is still, intact. So the hardwire is there, and we're trying to work on how to change things through a software programming,
Mm-hmm.
program, which is possible, but it needs time to work. And really, there is an absence of, or the lack of time for that to work, because our cultural environment doesn't respect the power and the restorative ability to help us recover during sleep. So if
Mm.
we, for lack of a better word, uh, handicap our developmental brain process during childhood, our expectations should, be tempered by the idea that the next generation won't have the same patience, won't have the same temperament, won't have the same response, right? So
Yeah.
those are things that we have to factor in. And these are things that I'd advise my family, my parents, when I go talk to the school, uh, we really haven't paid attention. We're only paying attention to the symptoms and how
Mm.
severe the symptoms.
Right, right. Feels like if it's like fire, if the symptoms are fire, we keep on just putting off the fire, but new fire gonna come out in other places without finding out the root cause. And when you talk about the hardware and software, that make me think, we possibly can help kids to develop and to program differently. They could build healthy habit, but they also are impacted by a lot of the social media and this just modern technology, right? It's just part of their life. So they're going to be programmed differently than us. But on the other hand, I'm thinking about the hardware part, because as younger children, their brain, all these neurons are really developed fast. I think, and I remember for the sleep part, right? So young babies, and they are developing and their own circadian rhythm very quickly for the first 6 months to 1 year. Then the hardware, will that be any difference from generation to generation that we're impacted?
My suspicion is that that will be borne out. We understand there's a genetic component to it. And as we're learning more epigenetics, we understand, that what happens to mom and grandmom can affect the child. So within a short period of time, you can have an influence in terms of the changes that may be occurring to that circadian rhythm, that hardwiring, right? So I think, you can rewire the same concept of firing and wiring when we address cognitive behavioral therapy, these kinds of things. It can play a role because it's refiring or rewiring a different pathway. But you need to prune away that the less optimal pathway, or that you need to build a connection above ones that are fixed. But the question is, to what extent is it fixed? To what extent is it embedded? To what degree, right? Everything is kind of based on the nuances of severity. So early diagnosis, early recognition is super important in that developmental brain. We expect our frontal cortex not to mature until we're about 25 years of age, right? But if we continue to impair its development, that 25-year person may be, in terms of maturity, at 21, but this becomes a greater concern in our teenage, where impulsivity is already a problem, and making decisions about reproductive health is probably not ideal in this situation, even in generations past. Can you imagine what would be happening now, where, impulsive young people are having children that are likely to be just as impulsive and just as disorganized? So they'll have less structure to work with, not only socially, but biologically. So that's where my concern is this toxic night is already permeating through our system. And we are just recognizing the symptoms, but not necessarily the toxicity.
Right. I really like what you mentioned. We should try to get early diagnosis and early intervention. When we think about diagnose for younger children, it's actually not many providers really consider include this toxic night or problems at night into diagnose, right? For example, my clinic, we do neuropsychological assessment. So we do diagnose ADHD, autism, and other different neuropsychological disorders. But the sleep is not part of that. And I know I heard from some other sleep doctors talking about, oh, we should really combine sleep diagnose into some of this psychological diagnose. So I'm wondering, what do you think? Is that a direction we should consider? Is that possible? What if the provider does not have the sleep training? What can we do?
Yeah, it's a challenge, the sleep field, while we try to advocate and educate, many things are slow to permeate into the community. And as parents or young parents, people are very aware of how important sleep is, right? But as older, they have this base assumption that, oh, everything is fine. But this is where the gap is occurring. Before you manifest illness or disease, that injury or that toxicity has been occurring. So a similar analogy, as they say, by the time you diagnose someone with Alzheimer's clinically, they've been suffering with it for at least 15 to 20 years, right? So the issue is that, as good as we are in terms of our history, we need to address the issue before the symptoms present itself. So the challenge, so when you're seeing patients or clients, you really have to address where they've been, where they are, and where they need to go, and based on, of course, the age that the child is presenting at. So the earliest years are the hugest amount of neurowiring that may be occurring, right? So that's, of course, any pediatrician will tell you early intervention is so important. So, the American Academy of Pediatrics talk about things like adverse events in life that lead to medical problems later on in life, right? So we know impacts early on can have lifelong negative effects. What I'm kind of presenting is this impact should be recognized even before the symptoms present itself.
Wow. Okay. Then if we need to catch it so early, which is great thing if we can, I'm wondering what, as parents, for example, what are some warning signs? What are some signals they should pay attention to help them detect possible toxic night early on?
Right. So, the typical kind of average diagnosis age, if you will, might be 7 years of age. But, if we do our screening and are very, attentive, we may be able to diagnose it as early as 3.5 years of age. So, presenting with things like, hyperactivity, it's difficult just to assess because there's a spectrum of what we consider is normal, right? So someone who may be all boy, where they're all active and they're all into things and they're all girls, and quote. So certain stereotype affect what we think, right? But this is in our traditional context without the exposure to social media, to the blue lights, to all this stimulation that's occurring in this young brain. So the context has changed, and we're expecting, kind of an old idea of what this 3-year-old child or 4-year-old child will be. If they come to your clinic and they're on the phone or their parents' phone or they have their own iPad, they've used it all day, all night, all through school, or before bed, this is really a concern, that should be addressed, by a pediatrician or by any primary caregiver, and frankly, should be kind of parental education, especially for young parents, because they too, their brain is still developing while they're developing this young baby's brain. That's a formula for, bad outcomes.
Yeah, yeah. I think you mentioned the parental control. That's so important. Like, uh, babies or children's young brain, how much this kind of new technology stimulates, very strong, right? How much they can take in, how that impacts the wiring in the brain. I think parents need to know more about that, know more science knowledge about that, and then to help them to make appropriate decisions to guide the child. And I don't know whether there's an age range and how much parents should pay attention to. But I think I heard from others that younger children possibly should be exposed to this social media and high technology less than older children, right? So the parent gonna be the central role to manage this.
Right, exactly. So, having a sleep routine, having a biologic dark versus a, constant light before you turn it off, you're firing the brain and you're teaching the brain, fun, pleasure, joy until you crash. And then you shut down. And then when you turn back on, what do you want? Fun, pleasure, joy, right? So you are training this brain for this condition, and you're having expectation to go to school, to concentrate, to have patience, to have emotional stability. That is counterposed to what you're actually training this brain to do.
Wow, totally. That totally makes sense. When you said that, I was like, oh, that's a lot of adult what we've been doing. We play phone, we watch something fun until the moment we fall asleep. And then the first thing we open our eyes is to grab our phone and be online again. And think about what that can do to a younger child's brain, right? A lot of time now when I watch those short videos online, I got hooked. Time just passed by, and I could not imagine if I was younger and back then, if we had this, how are I going to resist that and still keep a good attention span to focus on school? There's no way.
Right. So, you know, interestingly, the Surgeon General just came out with an advisory about social media and in
Oh,
children just last week, right?
oh,
So
okay.
if information that says that teenagers on average spend about 3.5 hours on social media, and that, you know, even adolescent girls are addicted to the social media. So this addiction is already occurring in the adolescent, if not earlier. It just hasn't been studied. But it would not surprise me to say later on that this brain has been addicted even earlier than what we are recognizing, because there's a lack of information or data. But I think we should be able to use our brain and our understanding to say, this formative years, we are forming an addicted brain that is not well advised, right?
Yeah, that's scary.
It is a little frightening in terms of to think about it. But again, it's for me really identifying the toxicity in the system
Mm.
and really, you know, working on helping parents establish, you know, a good routine for themselves and for their children.
Right. It sounds like parents can really get the information, follow some general guidelines, and adjust their own schedule and help their children to adjust it. What if some parents they are not able to figure out a good way for themselves? Where do you think they can get help?
Well, you know, of course, talking to their family provider, you know, and talking to their child's pediatrician will be helpful. I think the American Academy of Pediatrics is getting better and better in terms of meeting the primary doctors, you know, about sleep health.
Mm,
Uh, Having difficulty, of course, consider a board certified sleep specialist. You know, there are pediatric sleep specialists as well as, of course, adult sleep specialists that can, you know, as you are taking care of, you know, parents, this is one of those entryway to say, have you considered what's going on in your child, right? Because that routine is going to be maladaptive as the child progresses when they go into upper grades, when they get to high school, when they get to college. All these things are going to continue to fracture and challenge this brain. And my concern is you hear in the news all the time where, you know, the seniors are bullied or the college student is sleep deprived, go on a rampage, right?
mm,
What is likely they're subjected to acute sleep deprivation, you know, and that it triggers anxiety, depression. They're comorbid to this brain. And so they have a fracture or a break and of course access to weapons, and this break in their psychology can lead to devastating outcomes.
mm.
So I'm kind of worried that more and more occurrences like this will occur because we've conditioned this brain, you know. And so again, is what are we expecting in terms of, you know, training the brain to do one thing and expecting it to do something else?
Right, right. I think as the technology develops, we all need to adjust our expectation also, but also the way we guide the children and ourselves. Sounds like children's problems are not only children's problem, it's a whole family's problem, and it's a interacts with parents' problems. They impact each other. So, but I got a question from parents often that they are thinking about, cut off the internet and have a technology curfew at night, right? A lot of parents, they just feel like they cannot really control the children's usage of social media. So do you
Yeah.
think that's a good suggestion for some families?
So going back to the sugar issue, right? The exposure to the sugar, it's an addiction. The brain craves that sugar, right? So the idea is, can you reduce it slowly? Just like any addiction, you're going to undergo withdrawal. The brain is going to fight for what it wants. So if you need that dopamine and you deprive it of dopamine, you're going to have a very bad outcome, right? A bad response, right? Especially in a child's brain who frontal cortex isn't regulated, right? So they don't have good impulse control. So this is where your guidance to kind of say this child or in this particular phase, will need slower, changes, not dramatic changes. So, you can't rewire it that quickly, but you need to strengthen the wiring and then give it time, meaning the time to sleep. So as much as we have all this therapy and we identify it in school and we have these programs, and then they go home and instead of getting 9 hours of sleep, they get 5. So all that work in the day will not take in the night because the brain is still bricked. It's still not able to incorporate into learning memories and learning centers what you've worked so hard to do. And then you go back and you give them another 3, 4 hours of working session under the same condition, it just seems counterproductive.
Okay.
So we're
So,
too focused on one end of to change the program, change the software, but we don't allow for the time to change the hardware.
yeah, I never thought about that angle. So really should think more sounds like long-termly. And again, go back to your original idea, it's not just about the symptom. You cannot just target the symptom and contain them around the symptom. Have to think about deep down how you can slowly rewire the brain. And
Right.
yeah, sounds like a healthy sleep schedule, and some routine build up. Those like long-termly can help children, teenagers rewire the brain.
Right. So, the things that I tell my parents, is what is their natural sleep time? And if they have delayed sleep phase, we need to work on, improving that, improving their circadian, right? And slowly reduce their light exposure before that biological night. So you can have social media, but far away from your sleep so that you're developing a different routine. So you can convert to a book or something else that doesn't have that blue light exposure. Because that blue light can push your circadian rhythm, your biological sleep time as much as 2 hours later. So as much as you want to say, okay, we want to go to sleep at 9 o'clock, but you have social media at 9, it's unreasonable to expect that child to just instantly fall asleep, right? Because it's working at that circadian rhythm that's been pushed back. And so the child's going to struggle for 2 hours trying to go to sleep and get frustrated and start to hate sleep because it's craving that dopamine from social media. So now sleep becomes a greater problem. And so now the child needs the social media as the pacifier to sleep, which is counter. So of course you'll hear parents who say, "Oh, I can't sleep unless the TV's on. I can't sleep unless, I have some stimulation." Right. That to me is a clue that that brain is wired differently. And we need to work to rewire that brain. But if the parent's doing something, the child's going to do the exact same thing, no matter what you say. Is the term is right. Do what I say, not what I do.
Right. Yeah.
That work for the child. What you do, so you as a family have to be the role model, right? Is to provide that change and be consistent with the change. And we know with kids, consistency is key. If, the child goes to bed at 9, has that wind down, and then goes to grandmom's house, and grandma says, do whatever you want. Or, if they're coming from a broken home, one family versus another, that upheaval will disrupt that child's, routine and rhythm. So there are many things socially that is affecting the biological process. And so it's not a simple one. So, treatment, just like many things, should be kind of tailored and not be generic. But the information about the possible harm should, kind of get disseminated to all parents.
Right, right. Wow. So all this, like how parents can really help to maintain a consistency, healthy and helpful, mostly routine, schedule, and habit in the whole family, not only among the children. Sounds like very important. So a lot of work on the parents
Right.
to start from parents. Mm.
Yeah. And, as we become more aware, we have to think about the next generation.
Mm.
So when we talk to the parents, we say, 80% of what your child is suffering will occur in adulthood. And what percent of that is heritable? So when your grandchild appears, does that predispose that grandchild to having similar, if not worse, symptoms? So, it's multi-generational. So to me, it's that level of impact that could be occurring. Because like I said, the data shows the prevalence is rising rapidly. And so why is that happening? And that's happening because it's been happening.
Mm. Yeah. Okay. So definitely. And so it's a whole family, it's generation by generation, and the different generations effort together. And so that totally makes sense, even for adults, when we see a specialist, if the provider can help mention a little bit, just help the adult think about their next and next generation, it's already going to start making the change, right? Sometimes parents overly focus on children. They sometimes even throw a children to a psychologist or a provider, say, fix my child.
Right.
But it sounds like it's not just the child themselves. It's not just their problem. Everyone
Mhm.
in the whole family system need to make some shift or change
Right.
the mindset.
Right. Not uncommon in my clinic, you have a mom bringing in a child and saying this child is not sleeping well, and then you have a sibling who's on the phone, or right, a
Yeah.
spouse who's on the phone. That would suggest that exposure, is what is contributing to this child who's manifesting at this time.
Mm.
But later on, it will be this child on the phone
Mm.
because the American saying is the apple doesn't fall too far from the tree. Certain behaviors, certain, physicality, certain genetics, there is, a proximity effect.
Yeah. Yeah. And also what you mentioned earlier, I think some part is how to help the children or the teenagers to develop self-soothing technique, not really rely on high technology, social media, or something else, how they can do something more calming, peaceful, and they can control to soothe themselves right before bedtime as part of the bedtime routine.
Right. Yeah. So, I think when we talk about neurotransmitters and dopamine as being a pleasure, right, neurochemical, I think there's a toxicity there, the idea of pleasure and happiness. So this warning from the Surgeon General really is kind of highlights the idea that, the body image of children, their outlook, etc., is negatively affected by social media, right? But that's because this dopamine reward system isn't counterbalanced by a serotonin happiness system. So the idea of serotonin is a happiness that comes from within. But socially, when we see the marketing and the advertising is, you're not happy unless you buy this. You're not happy unless you have this. So we talk about a material world, but that's because it's catering to that brain that is confusing pleasure and reward for happiness. So it's very difficult. So we need to be able to cultivate that. When we talk about kids' health and brain health and psychological health or mental health, right?
Mhm.
Is do we have that happiness drive, or is it all driven by pleasure? But that's your area.
Yeah. So I think that's why a lot of time we need teamwork, different providers, different areas all together to help a family thrive, to have a child thrive.
Right.
And yeah.
So from the sleep standpoint, if you sleep deprived, your perspective generally is very negative. So we say, if you deprive someone of sleep chronically, they're going to be a half empty glass perspective, right?
Mm-hmm.
Everything is, but if you give that child enough sleep, that will be a half full glass. And that's kind of point out in studies that your perception is more negative when you are chronically sleep deprived. It won't make us a better world if we approach it as half empty.
Yeah. Oh, I love that. So how to be more optimistic in sleep, because I treat insomnia a lot. For sleep, a lot that is perception. It's mindset, right? How we perceive it, how we interpret certain sleep issues, and how we perceive sleep difficulties. And do we have the correct knowledge, or it just all this wrong information randomly online on the social media? So all this, how we think, impact how we behave
Right,
around the sleep.
right. But how we rest and how we recover affects how we think. So, the snake chasing its tail, meaning, it's very bidirectional or circular, is that both ends are just as important. So if we want effective change, we have to affect the entire process. So, as a sleep doctor, it's really trying to get people to respect their biological night. So when they're losing it and it's crumbling away, that, to me is the toxicity of that loss.
Right. So that totally makes sense. Now think back this whole concept you talk about toxic night, right? So how I want to encourage everyone who's listening or watching to really think about what can you do to help prioritize sleep, not sacrifice your sleep easily for other things, and in what way you want to approach sleep, how you act, how you think, and really think about what sleep can do to you, to your brain, to your health, to your next generations.
Right. That's the thing is, culturally, we haven't respected sleep and we have forgone sleep for different reasons. But the social media, the access to light, especially bright blue light, is changing our biology and changing our hardware, but we are not aware of it. And it's changing likely earlier on. And I would only guess at this point, but when someone looks into it, I would guess it's probably changing in utero, meaning that, as the mom is carrying that pregnancy, this exposure is probably occurring even before. So, that's yet to be born now, but that's kind of my speculation at this juncture is, as future parents, we're always looking for things to make sure that the baby is as good as it can be. And so we need to back this up even in terms of earlier in life, earlier in conception or even preconception, right? So we know in terms of fertility, etc., if your circadian rhythm is alignment, you're going to have better success. So as we continue to back this up, we keep seeing where potentially this toxicity in that night can be disrupting our biological system in various ways.
Yes. All these are very important topics and for everyone to really pay attention and remember. And I know ASM has a lot of resources as well. And at the end of our show, is there I think you mentioned some resources already. If anyone got inspired by our conversation, where can they find more information to read, to understand?
I think, I'm part of the ASSM, so it's a trusted source of information by board certification, with expertise and ongoing research. And we always have information that gets updated, and is available for people to seek as a resource for all these sleep conditions. So, there's so much information online, right? It's really important buffer it with trusted sources of information. Of course, some information comes out sooner rather than later, and some data is not meeting the criteria to put into guidelines quite yet. So talking to a sleep specialist or someone who's kind of more current in their process and thinking and literature so that they can incorporate that into the child or the patient, making it more specific and not a generality. So, along those lines, things like medication, I'm kind of concerned that we're a little bit too quick on utilizing medication. They are effective, right? But, treating the symptoms does not treat the toxicity. So I like analogies, but if you take something to reduce your fever, it doesn't address why you have the fever, right? But the issue for me is that developing brain is now seeing stimulants, seeing more dopamine, seeing all these things, right? In the long term, how does that help with the rewiring of the brain, or does it do the opposite? Is it like insulin? Is that more is not necessarily better in the long term?
Right, right. And I really like all the concepts you shared, and sounds like you're doing great work in your own field. So if our audience are curious about your work, your clinic, and or if they live in California, they want to seek your help, how can they find you?
I can be reached at my website. It's called mysleepmd.com. And I can be reached directly through my email. It's artinmedicine@yahoo.com. So hopefully
Oh,
that'll be remember, yeah, because I'm an artist, and so I enjoy painting and kinds of things. So I think it has therapeutic benefit, at least for me, and it helps me be happier. So that creativity is something, as you probably appreciate, I'm really aware of that brain and developing that brain to be as rich as possible. So encourage things like creativity is great for sleep. If you, paint, or if you do some creative endeavor, it changes your brain. It gives you a, a happiness, a reward that is very different from consumption of social media or Netflix or any of these other things. I think that's kind of lacking in our life, in our children's life. And so fortunately, in many places, the programs are eliminating creative processes in schools, etc., right? Because we're trying to force this brain to do something rather than encourage this brain to develop. So,
right.
yeah, that's
Yeah.
something that we keep in mind. So,
Yeah.
as a
In that
pediatrician,
part.
as a sleep doctor, we're always advocates, right? But we're advocates for overall health.
Yeah, definitely. And you definitely become a role model in this to modeling, right? There's so many things you can try and enjoy that is out of this technology. And it totally can be combined. But we want a balance. I think in Asian culture, I grew up in China. Asian culture is all about harmony and balance. So don't just squeeze into one corner. I only have this. I only want this. Even it gave me a lot of trouble, I still only want that. So how to spread our attention to try different things and see what's good for you.
Right.
Yeah, so I will put all your information down in the below in the description box for anyone who are interested to check it out.
Right. So I hope our listeners at least get the term toxic night. At first, it sounds odd, but you put those blocks in place and put it into context and look into your own lives, and understand, wow, I'm actually giving away so much sleep time, right? And I think hopefully that seed will take root so that we can have greater changes.
Yes. Well, thank you so much, Dr. Saito, for sharing all this wonderful information and this awesome term, toxic night. And after our conversation, it totally makes sense to me. And to hopefully this really help everyone who are listening and watching to really think about what's the relationship between our sleep and our brain development, and what we can do to make some changes as needed.
Right. Well, thank you for having me. I enjoyed talking with you, and perhaps we can talk again on other things.
Oh, definitely. Thank you.
Take
Okay.
care.